So for our next two speakers, we have Larry Leung and Jason Ming, who are going to provide an example of some initiatives they're doing at their school. So we, some of our committees scoured the country to see what different provinces are doing with respect to Aboriginal engagement, and this one really stuck out as a good example we can all learn from. So we have Larry Leung and Jason Ming here, who are both lecturers with the Faculty of Pharmaceutical Sciences at the University of British Columbia. They're clinical pharmacists as well at the UBC Pharmacist Clinic. Jason and Larry provide clinical pharmacist services to different Aboriginal communities in BC and created a pharmacy course in Aboriginal health based on their experiences. Please welcome both Jason and Larry.
Hello, thank you so much for having us, and thank you for the introduction, Carrie. Again, my name is Larry Leung.
My name is Jason.
And we're very, very excited about sharing this work. It's something that we're very, very passionate about. So today, what we're going to really do is we're going to tell you a little bit about the work that we do before we got into UBC, and how UBC has supported our work and will be continuing it, and how, based on our experiences in the work that we are doing in rural and Aboriginal communities, we created a course specifically for pharmacy students in Aboriginal health.
No disclosures to report. So a little bit about us. Larry and I have been working together since 2010, and we met in residency together. And since then, we have been working together under Clinic Care Pharmacists, which is our non-dispensing pharmacy company that we've been working under. And basically, through that organization, we deliver clinical services to patients in the community. And through that work, we've been very fortunate to have had experiences in many rural communities and Aboriginal communities in BC, across BC. So currently we have provided services to the 4 communities listed there, so Bella Coola, Bella Bella, Clem2, and Mount Currie. And we're excited to be working with the 5th community quite soon.
And so we feel very honored to have been recognized for some of the work that we've been doing. And so, and also just the support that UBC has in terms of moving this work forward and providing more practice support. So in terms of the clinical pharmacy services, just to give you a background of what we were doing, pretty much when we were organizing, we still reminisce about how we were in the basement of my house, just trying to figure out how we can deliver patient care to these places. We run 2-week pharmacy programs per community every 6 months. And so these pharmacy programs, we kind of clump them into 3 groups. We do specialized collaborative clinics, we do home visits, and we do disease education and academic detailing. The whole point of these programs are to provide practice support for physicians and nurses and other healthcare professionals in the community. And the crux of what we do and what all pharmacists do is to provide comprehensive medication management and medication reconciliation to all these communities. And so the first service, just to give you a little more background, is the specialized collaborative clinics. So what we mean by that is we run foot clinics, blood pressure clinics, and falls prevention clinics, at least one of those types of clinics while we're there. But what we think is very, very important when we're going into these communities is to make use of existing resources. We're very, very much about collaboration in everything that we do. And so before we even start to come up with a new program, we look at, what are existing programs already and how can we help to improve on them. And so the pictures here, an example is the foot clinic that the nurses do all the time, and they see 36 patients a day. Perfect. They're already coming to the foot clinic. How about you talk to the pharmacist as well? And the other is just an example of Jason doing a one-on-one consultation on a patient.
Home visits is another large program that we do. We tag team with the home and community care services that are already in the communities. And one of the huge advantages, obviously, of doing a home visit is you get to see what the patient environment is like at home, what medications they have in their cabinet, and if they're so willing, we will remove unused or expired medications as well. So there's Larry, one of the patients. Disease education and academic detailing. This is a very popular service that the community asks for, as well as the healthcare practitioners in the area. And so we'll offer talks to the public about different disease topics. We'll also offer therapeutic or clinical topics to the team for anything that's on their mind or anything that's popular or anything new that might have came out.
So this is just a picture of, we like to be involved in community events. So the first picture is during the elders lunch. That's the first time I did it, so that's probably why they don't look super interested, but I promise they warmed up to me. So it's important just to go out to these events. We met all the elders. We talked about sort of the services that we provide and how we're very much about balancing evidence-based medicine with traditional medicine and informed decision-making, and kind of bringing those all together, because I think, going through school, we focus so much on evidence-based medicine, and that's really important, but also taking into account what the patient's values and beliefs are. So that kind of gives you an overview of what we do in the community, and it was such a steep learning curve for Jason and I when we were in these communities, and we were thinking this would be so important for students to learn about cultural competency, about the history, about how about the stereotypes, where they come from, and how we can break those barriers. And so we were looking through the UBC strategic plan when we were in the basement of my home, and we came across this in our UBC strategic plan about the goal of expanding our educational opportunities for Aboriginal people and widening the opportunities for all students to learn about Aboriginal issues and perspectives. And I kind of chalk it up to us being very naive. I was like, we should come up with an elective. We can't do that. And Jason was like, let's just contact David Fielding. And so we just went out of the blue, contacted him, talked about our idea for an elective, and here we are today.
We're also very fortunate that not only does UBC have Aboriginal engagement as one of their key strategic plans, but also our faculty has that as well. So we're very fortunate about that. But the goal of the course really is essentially for students to learn how to provide effective and respectful and collaborative care to Indigenous peoples. It's not a course intended for Aboriginal students per se. We actually haven't had any self-identified or self-declared First Nation students actually take our course, but it's designed for anybody that would like to learn this as well. And the key here really is the cultural competency as well.
And so in terms of course content, just to give you a little overview of what we do in the course, Jason and I don't claim to be experts in the area, so we do include a lot of different scholars and elders that come into our class. And so we always start off with some terminology, just talking about, the right way to, what's the difference between Aboriginal, First Nation, Inuit, Métis, just talking about those differences. Then we move into residential schooling and colonialism and the impact on health. Then we transition from the history to look at where is the current landscape of pharmacy right now in terms of the First Nations Health Authority, how does that interplay with the other health authorities, cultural competency in workplace, looking at non-insured health benefits. That's a huge one that we have a lot of students. That's one of our most popular lectures, just because they come into practice and really we haven't had too much on NIHB. Traditional medicines, and then of course, because it is a pharmacy course, we move into some of the health areas of interest, including mental health, pain management, sexual health. And so those are the topics that we go through.
And we always laugh because the way that the course content is, it doesn't feel like a pharmacy course. It feels almost like an arts course. And so that was, it's actually quite fun to teach it. The
students like a break from from all the pill talk and stuff like that. And so in terms of teaching methods, we like to do a lot of immersive type things, and so our educational trips, we incorporate a lot of different educational trips. It is an elective, so we do teach it in a 3-hour block once a week, so students can go on field trips. So we do a tour of the UBC Museum of Anthropology First Nations exhibit with the whole purpose of just having the students be a little bit more aware of the different culture and histories, and gaining a little bit more respect that way. We visit the UBC Longhouse and the Weewa Library, and what we're adding this year is for the students to get a library tutorial from an Aboriginal librarian who will talk to them about how to research and how to search for certain terms or certain papers that you're looking for in Aboriginal health. We tour the Musqueam Cultural Center, UBC Botanical Gardens and Center for Plant Research when we do our talk on traditional medicines. And then, of course, we'll also take them out to East Side Pharmacy, which is in the downtown East Side, which does have a high population of Aboriginal peoples. and then also get a tour of the Vancouver Native Health Society as well. So those are just some of the examples of the trips that we do.
And maybe I should explain that UBC, we mentioned Musqueam, we'll mention that again several times, but the Musqueam Nation, UBC is actually situated on traditional Musqueam First Nations land. So we have a very close connection with them, and proximity-wise, they are also the closest to us. So not only do we like to bring our students out to learn as best as we can, we try to bring that experience back into the classroom for them. And so what we're very fortunate about is we will still run these clinical programs throughout the school year. And so Larry or myself may actually be out practicing in a community while this elective is still ongoing. And so what we try to do then is we make a lot of videos, or we will do live video conferencing. And so as an example, last semester we had Larry, who was in Bella Coola, and he was able to Skype into the class during class time, and we were able to get a tour of the area. He was able to show us around. And what was really neat was he will actually bring us through video Skype in to see the patient as well. So we were able to experience a home visit with Larry with the students as well. And so I would be on one end and he'd be on the other end. And of course that requires patient consent. And the way that we actually worked it was Larry actually saw the patient already, obtained the consent, worked up the case. He had already made all the recommendations, but he sent the case information to me, where we then cleaned it up, presented it to the students, which gave them an opportunity to work it up. And then Larry did a follow-up home visit with the students not realizing that it was the second visit. And we offered the students a chance then to interact with the patient and say, okay, you've had a chance to work up the case now. What are your recommendations and what are you going to say? And so we found that's hugely popular with the students. It gives them a chance to experience a real live patient. So that was really good. We also shoot video segments. So as best as we can, we will teach some of the course while we're actually physically there, and we'll record ourselves talking, which is very awkward because we're often holding the camera like this. And we'll actually record part of our lectures, which we'll save, and then we can use that as material following up. So we have a sample, we have a mashup of what these videos might look like. We're going to mute it on purpose because it's just a collection of a bunch of different videos all at once. But this gives you an idea of what a video vignette might look like.
Candice's video was much nicer, so. But yeah, this is an example of what we'll show with the class. So I'm heading out to Bella Coola, and then video blogging is so popular among students. So we start vlogging, and I'm talking about what it's like to be on reserve, and just giving them a kind of a tour of what things are like, what the Bella Coola General Hospital looks like. So I include clips like that, the New Hawk Nation Administration and Health Center, so we include that as well.
There's me in front of the health center, so I forget what lesson I'm teaching them here, but I'm talking about something important. There's another clip of the hospital, so that's in Bella Bella, and this is actually Larry driving to the home visit.
And so the part we cut out, of course, just because there's patient faces on there, is what was amazing about this particular trip was the patient actually shared their story on residential schooling and colonialism, and how that impacted their health, and how there's this cyclical nature and generational cycle of violence and abuse. And so the students had learned this from one of our elders and one of our scholars in class, but it's so different when they hear it firsthand. And this really, really hit home with a lot of students in terms of how they are interacting with their patient, Aboriginal or non-Aboriginal, just having that professionalism and cultural competency when working with other population groups is so important. And that's something that we want to roll out more in our course, so that more of the students can interact with the patients that we're seeing.
So like Larry alluded to, we do ask guest lecturers to come in. So we're not experts in all of the different areas. So we do engage with elders, different scholars in Aboriginal health. So we have historian experts as well that will come in. We have Aboriginal students that will also help, community members and other healthcare professionals. So particularly the nurses and counselors in the communities that we work closely with, they will be able to Skype in and offer their points of view and their insight on the different topics that we teach. So that kind of gives you an idea, hopefully, of how the course content is and how the structure is. We wanted to talk a little bit about what got us to that steps and how we're going to proceed and hopefully move forward with this. And so we heard all about engagement already, and that is absolutely 100% true. And so we've engaged as best as we can with as many different partners as possible. And so from the community, we are pursuing further engagement with the Musqueam. From UBC, we're very fortunate to have many, many very good resources in Aboriginal health. So the Center of Excellence in Indigenous Health would be the primary one. And also our Curriculum Advisory Committee, which we formed as part of the revision and feedback process of our syllabus and our content. And so on the advisory committee would be First Nations community members, First Nations healthcare practitioners, and health directors as well.
And so, of course, student feedback is also very, very important in terms of the ongoing development of the course. So we do, of course, have the student feedback just through the regular UBC course evaluations, but with Dr. Judith Soon, who has helped us, we also got ethics approval for a pre and post survey to the students. And we created the questions based on a focus group with different students in terms of what questions we should be asking in these pre and post surveys. And the whole objective of these surveys is to determine the impact on providing care to Aboriginal patients, looking at what is this student's self-assessed competency, how do they feel they are in terms of working with different population groups, and identifying changes that would further enhance student interest and competency. So for instance, the last year we got a lot of feedback in terms of increasing the content on non-insured health benefits, and so that's something that will roll over. And so the courses look quite different on a year-to-year basis. Even with the formation of the First Nations Health Authority, that's something we've got to add to our course just so that the students are aware of their role in our health as well. And so in terms of the lessons learned, early engagement is very, very important. And so like Jason mentioned, UBC is situated on traditional Musqueam territory. So engaging with different Aboriginal groups is very, very important to get their input on the curriculum. I think it's difficult to just create the curriculum and create the content first and then show it and say, what do you think? I think it's much easier to take a collaborative approach right from the ground up. Collaboration is key, so working with a lot of different faculty members. Jason and I are very, very lucky to have the support of most of our faculty. It's great, and a lot of them are here today who have really, really supported and lifted up this course to where it is at today. And then the continued improvement is also important through student evaluations, and our curriculum advisory committee is still intact, and every year we make sure that we run any new content by them, and if they ever have anything that they see in practice, because they are healthcare practitioners as well, we can add that to our course.
So in terms of future directions with where we want to take the course, we have a number of different projects that are on the go right now, and so we hope to see those come to fruition as soon as possible. So sustainable engagement was one area that we really hope to continue doing. And so the one idea we had was for the student final projects, we want them to actually contribute to a health fair, an annual health fair at the Musqueam Nation. And so we thought, how cool would it be if the students' projects then actually meant something meaningful to the community, and year over year we're able to provide different and fresh ideas from every new group of students that come in. We're hoping to work closely with the UBC Pharmacists Clinic, where Larry and I also both work, and providing greater and enhanced level of patient care in the communities that we work in. We're also working on a library research guide, which we think is really cool, where it'll be an online collection of pharmacy-based resources in Aboriginal health that will be available through the UBC library and open to the public. And so we had a hard time finding resources ourselves, and so we want to create a library guide that's available to not only our students, but anyone else who would be interested in this area. And of course, collaboration with other faculties. And so at UBC, medicine has an arm that focuses on Aboriginal health as well. And so we want to work closely with them and also with the Faculty of Nursing, School of Nursing.
Questions?
Any questions?
Candace, perhaps if you want to come up here too, in case there's questions for you as well. And I see.
You mentioned that you had a project with the students at the end. Is there any other assignments besides that, or is that how you assess the students?
We do, we assess in different ways, so class participation includes as well, but we also do journal club because it's very important to continue the critical appraisal skills. So every student, we begin every class with a journal club just to keep things fresh and light. And so a student will present on a journal article or a news article about something surrounding Aboriginal health, and then we have a discussion period. So the journal club is part of what we do. Participation during class discussion, attendance of field trips, a midterm quiz just based on more of the details like the terminology and some of the basic landscape of where we are in pharmacy. And then a final project. We do have a final project right now where a student will have to develop a health program in collaboration with a community and then present a 20-minute PowerPoint presentation, acting as if they were presenting this to a health director, similar to what Jason and I had to do when we were first pitching our own program.
Larry, Jason, how many times have we offered the course now?
So we've offered it now for 4 semesters, so 2 years.
Okay, and what's the enrollment been like? I think people might be interested in that.
So as an elective, we decided to cap the enrollment at 20 students, and the first semester we had, I think, only 8 students, but that's gone up dramatically. So we had 14 students register in the next semester. The year after that, we had must be around 16 students, and then the most recent semester we had, it dropped off a bit, so we had, I think, 5 students register, and actually we decided not to offer the course with that registration and instead focus on the improvement of the course.
I think there was a question over here.
Yeah, I was actually going to ask the question about enrollment, but I'll ask one about what you talk about about NIHB. I think within the pharmacy culture, NIHB has a certain reputation. I don't know what the reputation is among Aboriginal folks of that program. I'm just interested in what you talk about.
That's a good question. It's a loaded question, actually. BC is actually moving away from NIHB. They will be creating their own version of NIHB now that the First Nations Health Authority has been implemented. So we're going to be changing our lecture, obviously. But I think from an insurance point of view, if we think of it as it is, a lot of people, it's very easy to say your insurance coverage, sucks, for lack of a better word. But we teach in terms of the history of NIHB, the purpose of it, and we will go into the finer details of, how do claims get processed? If you get rejected, what are the different alternatives for the patient? And the mindset is, if a patient is not tolerating or cannot take a certain medication that is covered by NIHB, well, what are the alternatives that we can offer? Because if the alternative is something that's not covered under NIHB, then you may not have the patient that wants to take it anymore. And so we need to work around some of those issues, and we see that in pharmacy practice all the time as well. And so it's a matter of troubleshooting and finding out, okay, what are the different avenues that NIHB offers that you can get around some of those.
I just wanted to commend Larry and Jason on this work. I think it's just so important that this is part of the academic curriculum. One of the things I did want you to just maybe elaborate on is how do you talked about learning cultural competence. If you could just comment on that. And the second question is more related to this library resource. You said it's going to be available through UBC, but I also think it would be great if there's a way to make this available nationally so that other pharmacists out there could access that information, maybe work through CPHA.
So in terms of for the first part, the cultural competency part, there's multiple sectors to that. That's something new that we just started working through. What we're looking at is not only just having elders and other patients talk about their experiences, I think the Aboriginal patient voice is very, very important in looking at, what was their experiences with healthcare practitioners. And we're going to create some video vignettes in terms of an interaction, maybe an inappropriate interaction, and having students look at, what could have been done better and what could have been avoided. And I think a big thing with cultural competency is just understanding that history piece and having respect for that, where people are coming from. So that ties into a lot that we're doing. We do different assignments as well in terms of stereotyping and how we can get around that. So those are just some of the pieces that we touch on in terms of cultural competency. And in terms of our library resource guides, like Jason mentioned, it is going to be open to the public. So we're not going to just hide it away. So we're in the process of working with the Weewa Library and the pharmacy librarian in terms of creating this, and we've already started uploading some of the resources that we have and sort of some of the research papers that we have found. And we really, really hope that other faculties, other universities will look at it and maybe contribute to it as well.
Well, I want to say thank you very much for that presentation. It's great. It's sounds so wonderful. So I have two questions. You talked about talking to the other faculties. So I wondered, is there interest in taking medical students and nursing students? I mean, it seems like the perfect opportunity for interprofessional education. And secondly, how resource intensive is it in terms of your time, but also money to put together a course?
That's a very good question. I think UBC, we're fortunate because we have the College of Health Disciplines and what they call interprofessional health, so IHHS courses, and those are geared around sort of the interprofessional activities and events. And so actually, from the point of view of our course, in the communities that we do go to, they do bring in nursing students from UBC as well. And they do have medical residents, and we do often work with them as well. It's a matter now of the preceptors getting together and from a higher up standpoint, discuss, okay, can we now share students when we go to these different communities? And can we share our video vignettes? Can we share some of the lessons we've learned from the pharmacy point of view? And I think that's something that we're working on as a faculty in general, not just in First Nations Health, but across all of the different activities. And for your second question, in terms of resource intensive, just our time and our salaries, I guess. But it has taken a lot of time. It is a lot of long hours at home and the burning the midnight candle for sure.
A question for Larry and Jason. As far as sustainability is concerned, as far as your visits, home visits, educational sessions that you're providing, do you have opportunities for reimbursement for those services you're providing in BC? And can you tell us a little bit more about that? Because it's not usually the model of you dispense something and get a professional fee for it.
We kind of work on a hybrid model system. I mean, we first started off just volunteering our time for most of the projects, but we do a hybrid billing, so we can bill for certain medication reviews that helps to offset some of the costs, and it helps us keep the costs low for the community. But each individual band has been paying for our services. And what's great is now that the UBC Pharmacists Clinic is on board, just having that infrastructure, and we're going to be rolling over our services under the clinic very soon. And that will really, really help in terms of keeping it sustainable. And so right now it's working well, and we're going to keep going until it,
Excellent. I don't see any more questions, so I would like to extend a tremendous amount of gratitude to our three speakers for sharing their experiences and thoughts on this, and thank you very much to all of you.